euthanasia is the practice or the act to ending a life, and because one person is suffering sickness, and we have the definition. The act or practice of ending the life of an individual suffering from a terminal illness or an incurable condition.
Well, we wanted to talk about a little bit about some aspects, because as we know, euthanasia is a very controversial topic, so we would like to see the point of view of a psychological, medical, legal, and political, and a religious way.
For the psychological, the psychologist needs to consider their own point of view and examine a lot of influence about their own position, like training, rational arguments, personal beliefs, values, and experiences. Also, they need to determine the cognitive dissonance and ethical requirements to the individual decisions, that if they want to get some help about the condition, or also prevent if he or she suffer a mental state.
In this one, we can see a little bit like we saw in the movie of Jack Kevorkian, that you have to analyze each individual.
In medical, we can see that a really brief about how many see the euthanasia. So according to the American Medical Association, they're thought that are incompatible that as a physician role, because they think that it's impossible to control, and it could have seriously societal risks. So for that, we recollect some surveys about the euthanasia that were made to medical specialists. Next one, please. And we can see this, that physician-assisted suicide. 42% had both a religious and non-religious objection to physician-assisted suicide. The 31% had no objection to physician-assisted suicide. And we can see the other ones. We are going to see that just 5% that they had no religious objection to physician-assisted suicide. So we can see that are a lot of influence about religions in the matter. We can see this service, this service that you see below, is a service that was made to oncologists that were members of American Society of Clinical Oncologists, and they said about patient requests that 56.2% had requests for physician-assisted suicide during their career, and 38.2% had requests for euthanasia during their career. So we can see that the patient requests are a lot. It's not an insignificant number, so I think that this could be to take attention for part about the minutes. So, this one is about in cases where patients were facing excruciating pain, and 53% of physicians answered yes or probably yes to the question, will it have been alright when requesting from the patient to intentionally prescribe drugs so that patient could end his life or her life by overdose. So we can see this, that it sounds like paradoxically, because they say that they are not agree, but they will do it if in the case, well, most than a half, they do it if they were in the case that a patient asks for them to do it. And oncologists, we can see that 15.8% report participating in euthanasia or physician-assisted suicide. Just only 15.8%. minutes, please.
Well, we can see the legal and political aspects. These are very concrete because, as we know, in the legal aspect is something very serious because if it's legal, well, you can do it, you don't have much problem, but you have to complete some points that they ask you to, and if it's not legal, and if you have a relative or someone, you could go to jail. And in the political aspects, also we can refer to the movie. If it's for their convenience, they will support it, and if not, they will not, because the only thing the people want is like the vote of the people and liking them. So.
About the religious point of view, we found out that most religions disapprove euthanasia. Because the Catholic Church is the one that is most active against euthanasia, because of a number of reasons, like it is one of the 10 God's commandments that say you must not kill. Also, for the Catholic Church, human life is sacred and special.
Well, we have chosen these four countries to talk about, and we're going to say why we have chosen.
We choose Colombia because in Colombia and in all the world, it's a controversial situation. But in Colombia, even it's not totally accepted, the euthanasia has a legal situation in the penal code. They have an event where they mention the euthanasia as a mercy killing.
We chose Switzerland because we were looking for a country in Europe that doesn't have anything against euthanasia, and we find out that a lot of people travel to Switzerland to take advantages of the laws.
I choose Canada because it's interesting how a technologically advanced country with high levels of quality and education barely approved the assisted suicide in 2014, in this year.
And I chose the United States because, as we know, they are always one step ahead. They are our neighbors, and in many things, they are very permissive and liberal. But in this case, we'll see that they are not so much.
And well, in Colombia, euthanasia has been practiced informally by some doctors over 10 years, and was illegal the euthanasia in Colombia until 1997, when the High Court ruled that ending a life was not a crime. They mentioned this because in Colombia, even they were practice euthanasia is not totally approved. So they think that it could mention in the code penal as a mercy killing, that if you practice euthanasia, you have a very low time of spent in jail, as to 4 months as to 3 years. We have this example in Colombia. Dr. Gustavo Alfonso Quintana helps her patient that has 23 years old, and he suffered about a cancer. The cancer disfigured totally her body. So they practice euthanasia with that person.
Switzerland. Assisted suicide is allowed in Switzerland and is considered as a medical treatment. That's why a lot of people with terminally ill travel to Switzerland to take advantages of the laws, because Switzerland is a very liberal country. and here, well, in Switzerland, there's a clinic called Dignitas, which is about euthanasia, and their services cost $4,000. And if you want the funeral, the crematory, and so on, the cost could rise up to $7,000 euros. The case, an Italian woman of 85 years old disappeared from his home without telling their relatives that she was going to travel to Switzerland to commit suicide. She spent 10,000 euros, but the thing is that he was not sick. She didn't have a mental or physical illness, but she did it because she didn't like that he was aging. She didn't like how she looked. She didn't like how she looked.
Then we go to the United States. We know that they have federal and local government as most of the countries, and this is not regulated federally. This is regulated by the 50 states and districts and the District of Columbia. All of them prohibit euthanasia under general homicide laws, even though these laws are generally handled to state levels. And the 4 states that have legalized physician-assisted suicide, there are only 4, are Montana, Oregon, Vermont, and Washington. They are very strict in this matter, and they have some requirements. I put a chart. For example, Montana was legalized in 2009. You need to be residing in that place. Well, in the 4 of them, you need to be a person that resides there. The minimum age in Washington, Vermont, and Oregon is 18. In Montana, is not established because they no legal protocol in place, because they go analyzing each case. The same goes for the months expected to death. In the other ones, it's 6 months or less. If not, it's not permitted. And they need to be analyzed by two physicians, different, 15 days apart. They have to reside also in the state they live in. And they need 2 oral statements from them and 1 written in each one of these ones. Also in Montana goes for the case in a specific. I put some of the example from the ones that are prohibited, the punishments that they will have, how will they consider the euthanasia. In some of them, as we know, it's a felony, manslaughter, second-degree manslaughter. Penalty is unclear because it's also in some cases, and well, some examples. And this is the example. It's about Sue Rodriguez, which was a mom in the 30s, and she was dying very slowly by Lou Gehrig's disease. She lived several years with excruciating pains and suffering a lot, and she was always fighting, trying to get euthanasia given to her, but she never really got it until she was like at really the end, and for her to get it, she went through a lot of years of a lot of pain, even without having good time with her children, all that stuff.
It sounds almost also topic that Canada has allowed the law about the euthanasia because in 1983 the next one please, they published this in the official media about the Law Reform Commission of Canada recommend against legalizing or discriminalizing voluntary active euthanasia. It also recommended that aiding suicide not be decriminalized where assistance have been rendered to a terminally ill person. The next one, please. We can see about cases in Canada were a lot. Nancy B was like the first one. Was a Canadian woman who suffered a motor paralysis by Gilligan-Barré syndrome, and his doctor stopped his respiration support treatment. The laws of Canada don't charge anything about the doctor, don't put any charge in the doctor, but in the other years, we can see that an Ontario surgeon was charged with second-degree murder in connection with the death of a seriously ill cancer patient. Scott Mataya was a Toronto nurse who had originally been charged with first-degree murder in the mercy killing of a terminal ill patient. And we can see that the difference between that are in these two cases, especially are the second-degree murder was in a passive euthanasia, and the first-degree murder was an active euthanasia. The next one, please. Well, Sue Rodriguez committed suicide with the assistance of a physician. The death was investigated by police, but not criminal charge was laid. She fought to have a legal right to assist suicide under the Criminal Code of Canada, and she has a debate about this matter. But the Supreme Court, and her case was in the Supreme Court of Canada, but she ultimately lost the battle. The Supreme Court not accept to legalize the euthanasia. And the last one that I put in this presentation is the Dr. Donald Law, because he was a physician, he was a medic, and was diagnosed with a brain stem tumor in early February and died in September. He talks about that. He made a video in YouTube, and he talked about why they don't want to live, and they put a quotation about life in my body for 24 hours, and you're gonna thinking about what I'm saying. On March of this year, an act respecting end-of-life care passed into law, allowing adult residents of Quebec suffering unbearably with an incurable of terminal illness to receive a physician assistant at the end of life. This was just only in Quebec. The other states of Canada are not allowed this law. And the next one, please.
About euthanasia in Mexico, the Mexican law were modified in 2008, where they accept the passive euthanasia.
Well, I put here some of the modifications that were made in 2008. They permitted passive euthanasia, as they also included therapeutic cruelty as a term of the doctors that are like treating some patients that are incurably, and they are suffering, and the treatment is not making them better. So it's therapeutic cruelty because you are only making them go through worse for nothing positive at all. And palliative home care, which means when the people are really, really sick, before they could not go home, they have to stay in the hospital and die there for the ultimate cares and extreme measures they need to do. Nowadays, palliative home care permits people to go home to die with their loved ones in their homes, and they also need to take proper cares and treatments, but they can take them home. Those are like the more important and specific modifications that have been in the Mexican legislation.
In conclusion, we think that euthanasia is not a religious or political matter, but you have to decide what you want. We think that you are the only one who controls your life or your body, and that we don't have to expect anyone to do what we think is right, because it will be wrong for them. Thank you.
Thank you.
Okay, questions? Okay, I have a couple of questions. Brianda, which of the 4 countries mentioned? You mentioned four different countries: Colombia, the U.S., Switzerland, and Canada. Which of these 4 countries has the highest number of assisted suicide cases or euthanasia?
Switzerland,
Why?
because it's where the less requirements are needed, and it's like you can go, as ever said, pay, and they will do it. They don't make many questions, so it's the easiest one.
And you don't have to be a resident of this country.
Contemplate.
But you have to be quite rich.
Yeah.
Yes.
Because if you're poor, you can't do it. And Alice, where exactly in Mexico is euthanasia legal?
DF.
Where in Mexico?
DF.
Only the DF?
Yes.
Are you sure? Anybody has a question? Any other questions? Questions? Okay, thank you.